Arthritis in general is more or less wear or tear or wearing out of the cartilage at joints. So particularly ankle arthritis, focusing on the ankle joint itself, which is mostly going to be kind of your up and down motion, helping with gait. But it's going to be basically thinning or wearing out of the cartilage in its simplest definition. There's a lot of reasons why your ankles can hurt. It can certainly be related to ankle arthritis. If you've had a recent injury, it might be related to that. Oftentimes people can have ankle instability, and it might be subtle, and they can get what's called ankle impingement, which is basically a pinching sensation or a stabbing sensation around the front of the ankle joint, which could be related to some buildup of scar tissue or inflammatory tissue within the joint. Sometimes there can be little chips out of the cartilage, something called an osteochondral lesion in the ankle joint, and that can either be pain, or there could be mechanical symptoms, so a feeling of catching or clicking or even a shifting of the ankle joint. And I think the other thing to realize is when people come in and say, I have ankle pain, oftentimes it's not the ankle. It's the subtalar joint, it's the tendons around the ankle, it's the Achilles tendon in the back. There's many things in a small area when it comes to foot and ankle anatomy. So seeing a specialist and trying to understand, is it your ankle joint or is it something unrelated to that, I think would be the next step if the ankle's not getting better with very simple conservative management. For ankle arthritis, you certainly talk about conservative management first. That can be done with simple over-the-counter bracing. There's custom bracing for when you need more of a heavy-duty support to the ankle. Ankle injections can provide relief. It's not going to take away the arthritis, but can at least make the pain more tolerable and can sometimes last several months, even years, in the right situation. Over-the-counter anti-inflammatories, activity modification, wearing appropriate shoes that particularly help with gait if the ankle's stiff. All of those can be really helpful. Sometimes physical therapy can be beneficial, but in the setting of bad arthritis, it can maybe even exacerbate some of that arthritic pain. So you do have to be careful about some of the exercises you're utilizing. Outside of those options, you do get into talking about surgery, and it depends on the patient and their goals and what their day-to-day activities are. As well as their age and their deformity, what could be present from the ankle arthritis. But you could be looking at an ankle fusion, which is getting the bones to mend together at the ankle joint, essentially eliminating the arthritis, but also eliminating the motion. So it is a trade-off between the two. And then the other option, which is probably the preferred option now and arguably the gold standard for ankle arthritis in the foot and ankle community, is going to be an ankle replacement. So replacing the ankle joint, preserving motion to the best of its ability, and then it's a great pain relieving surgery. So arguably first and foremost to alleviate pain, an ankle replacement's good, but also preserving motion at the same time. I think the time to see somebody about your ankle arthritis is when it affects you on a day-to-day basis. It keeps you from being able to do things that you enjoy. Maybe you've tried some over-the-counter anti-inflammatories, you've modified your activity, and the pain is just not getting any better. I think that's the time to seek assistance and kind of see what exactly is going on, getting an x-ray and seeing, do you really have advanced arthritis? And again, being examined and evaluated and determined, is this even related to the ankle arthritis? Could it be something else, even though you have ankle arthritis? So I think when it affects you and keeps you from doing things that you want to do, that's the time to get it looked up.